I'm Angie Scott. I'm here on behalf of Racing Hearts, HES Heart Ready, and Health Education Services. I am also an AED expert. I'm the Santa Clara Unified School District's AED coordinator. Out of this orientation, we hope that you will gain 5 key elements. What is sudden cardiac arrest? What is an AED? How to use an AED? The state laws associated with having AEDs, and the emergency preparedness plan that includes AEDs. The mission of our organizations is to increase awareness and access to AEDs, to also empower the people to use AEDs to save lives during a sudden cardiac arrest. Sudden cardiac arrest can happen to anyone at any time. It's a silent killer. As you look at this graph, you compare cancer, suicide, and firearms, and still sudden cardiac arrest happens more often. American Red Cross says that 350,000 Americans die each year. That equals a death every 2 minutes. Sudden cardiac arrest is an abnormal heart rhythm where there's no pulse. Normally your heart is beating like this, but in sudden cardiac arrest, it's just shaking. And so what needs to happen is an AED needs to provide a shock to stun it and allows that natural pacemaker to take over. It resets the heart. So when you have someone in sudden cardiac arrest, they might have abnormal breathing where they're gasping for air. They also might look like they're having a seizure and their body might shake for a very short time. Bottom line is that the AED needs to reset the heart. You have heart attack and it's a plumbing issue with clogged pipes. But then you have sudden cardiac arrest, and that's an electrical issue, like your lights flickering in your home. 30% of the heart attacks can lead to sudden cardiac arrest. So let's look at an AED. An AED, or automated external defibrillator, is a portable, lightweight device. It has recorded audio prompts to tell you what to do. And it will solely decide whether a shock is needed. There is no human decision-making involved at all. The AED pads need to be put on bare skin underneath the clothing. And the bottom line is time is of the essence. For every minute that a heart is not beating, it's a 10% less chance of survival. So we want to be able to put on an AED as quick as possible to increase the survival and the quality of life of someone who's suffering from a cardiac arrest. So let's take a look at this AED. The AED is in a red case. As we open it up, you have the unit there, and underneath you have a spare set of adult pads and a spare battery. The batteries last over 4 years. If you were equipped with pediatric pads, the cartridge would be underneath this flap. Notice that the pediatric pads are front and back. You would just swap the cartridge out to be able to use them. And to be able to put the pads on an infant or a child that is 0 to 8 years old or under 55 pounds, you would put one on the front and one on the back in the center of the chest so that the electric shock goes through the heart and is able to reset it. On the adult pads, you would open that case and then you have your adult pads. This one goes on the side of the body and this one goes on the right chest. Raise your right hand and put it on your right chest. I want you to raise your left hand and put it on the left side. Notice it's at the base of the ribs and that these are where the adult location for the AED pads go. Again, on bare skin. If you're not equipped with pediatric pads, American Heart Association says we can use adult pads on little people and we just have to change the location. So we're going to put one in the center of the chest on the sternum at nipple line, one pad here, and one on the back between the shoulder blades. So that's how you rotate adult pads on little people. Every AED has a response kit. And so when you open it up, you have gloves, you have wipes, you have a mask if you've been trained in CPR, And then we have scissors. Scissors allow us to have access quickly to put on the pads on bare skin. You can snip, rip, and place the pad there. You can snip, rip, and place the pad there. Scissors will cut through anything. And then you have a razor so that the AED can firmly adhere to the skin. So all you're going to do is be able to swipe 3 times to be able to get the hair off. If it gets clogged, blow on it, wipe it backwards on a carpet. But again, it's probably only 3 swipes here, and if needed, 3 swipes over there. Now let's listen to what an AED sounds like. First of all, again, we're opening the package, and we can either turn on the AED by the universal power button, or with the on-site AED, you can pull open the cover.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
We lift up the shirt.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
This one goes on the left side.
No one should touch the patient.
Stand clear.
Analyzing.
Analyzing.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now.
Now before we push the flashing orange
Deliver
button,
shock
I am
now.
going to say
Press
stand
the
clear.
flashing orange button now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
So when putting on the pads, for women, you can move the bra strap out of the way to be able to put this pad on. Know that this is underneath the chest strap of a bra as well, so you don't need to remove the whole entire bra. Time is of the essence. We want to make sure we're doing this and putting the AED pads on very quickly. Know that there's a 2-minute timer going now, and we're continuously doing CPR until that timer is done and it says analyzing patient again. And that's when you would say stand clear. The whole time during that 2-minute timer, you're leaving the AED pads on, you're leaving the AED on, and so therefore it's ready to go in case if it's needed to again. If you're pulling the patient out of water, please just make sure you're drying off these 2 locations. Time is of the essence. We just need these pads to stick. And know that an AED will only shock a patient who really needs it. Now, let's take a look at how to do hands-only CPR. Time is of the essence. For every minute that the heart's not beating, it's a 10% less chance of survival. And knowing that it takes time for an AED to come back to the scene. So American Heart Association has created hands-only CPR, and that is chest compressions only, to keep the oxygenated blood going to the brain to eliminate or reduce brain damage. So you have someone who is unconscious on the ground. There's 4 words I want you to remember. Check. Check for consciousness to see if we can wake them up. Hey, hey, are you okay? And second, call. Tell someone to call 911 and be specific. Hey, you in the green, call 911. And 3, get. Get an AED. Be specific again. Hey, you in the black, get the AED. It's in the office and come back. And then the 4th word is do. Do your hands-only CPR. The heart is in the center of the chest at nipple line, and that's where we're going to put the heel of our hand is right on that sternum. We're going to interlock our fingers, and we're going to have our elbows locked and our arms straight. My shoulders are over my wrists, and I'm going to push down hard and fast. It looks like this. Hard is at least 2 inches, so you compress the heart between the sternum and the backbone to send that oxygenated blood to the brain. And fast is 100 beats per minute. That's to the song of Staying Alive. CPR is very physical, so we want to be able to have someone else on the other side so that if we get tired, we can switch. So if I'm getting tired, I'll say, all right, I need you to take over. On the count of 3, we'll switch. 1, 2, 3. I back out, and then they will start CPR at that moment. And just remember, when the AED is done analyzing and or shocking, there's that 2-minute timer. And so we need to make sure that we're doing CPR if they are not awake during the entire 2 minutes, and being able to switch as often as we need to. Together with CPR and AED, we want more sudden cardiac arrest survivors. So now let's put that all together. We're going to check. Hey, are you okay? So say check. Good. Now, we need to make sure we're having someone call 911 so the paramedics can get here quickly. So we're going to go, check. Hey, are you okay? Hey, you in the green, call 911. Repeat after me. Check. Call. Good. Now we're going to put all 3 together. Check. Hey, are you okay? You in the green, I need you to call 911. You in the black, I need you to get the AED out of the office and come back. So repeat after me. Check. Call. And get. Good. Now we're going to put it all together and add do. Check. Hey, are you okay? Call. Hey, you in the green, call 911. Get. Hey, you in the black, get the AED, it's in the office, and come back. Now I'm going to do hands-only CPR. The person that comes with the AED is going to put on the AED pads while I continue.
Begin by removing
with
all
CPR.
clothing from the patient's chest. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
You'll need to move it up just a little.
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic. No one should touch the patient.
Stand clear.
Analyzing. No one should touch the patient. Analyzing. Shock advised. Stay clear of patient. Press the flashing orange button now.
Stand clear, shocking patient.
Deliver. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
If you don't know how to do hands-only CPR, the blue button will tell you to do so. And then you continue right away with CPR. Now let's talk about the California AED laws. SB 658, which was pioneered by Racing Hearts and El Camino Hospital, has just helped us make AEDs easier to be everywhere. There's 5 things we want you to remember. First of all, no CPR or AED certification is needed to have AEDs in your premise. AEDs only need to be inspected quarterly, every 90 days. You need to place a display sign, how to use an AED, next to your device. You also need to provide yearly this CPR AED orientation. And the last thing is to know your emergency response plan. It involves check, call, get, do. When you call 911, make sure you know your 10-digit 911 number. When you have a crowd around, make sure you gain crowd control. Make sure you have someone that escorts 911 responders to the scene. Make sure you have multiple people helping with CPR and relieve each other as needed. And review this orientation on a yearly basis. On behalf of Racing Hearts, HES Heart Ready, and Health Education Services, we're happy to bring you this orientation. We hope that one day, nearby defibrillators are a standard of care and accessible by all. AEDs are a simple solution to a huge medical problem. because sudden cardiac arrest can happen to anyone at any time. Thank you.